This is a demonstration of Allscripts Professional EHR for general surgery. Today we're going to demonstrate how Allscripts Professional EHR can overcome your daily challenges and help you achieve meaningful use. In general surgery practices, most providers are challenged with referring provider follow-up, quick access to patient charts, too much time spent documenting office visits, communication with staff, and easy access to outside notes. Allscripts Professional EHR can help make your life a lot easier with encounter packs for easy referral letter generation, the face sheet, template use for ease of documentation, messaging, and easy access to scanned-in outside reports. Now let's take a look at how Allscripts Professional EHR can help meet your needs. You're logged in as Cindy Pope, who is the nurse for today's scenario. The nurse is looking at the schedule to see exactly what patients are scheduled to come in today and why they are coming in. If the patient's name appears in black, that means they have not checked in. If the name appears in blue, they have checked in and are sitting in the waiting room. The green indicates the patient has been seen by the nurse and their chart has already been started. The red means the patient has checked out. The patient for today, who has not been seen in your practice before, is coming in for a breast lump. She has already gone online through the patient portal and filled out most of her history. Once the nurse opens the patient's chart, it brings her right to the face sheet. The face sheet shows the patient's entire chart. Because the patient has already gone online and filled out her history through the patient portal, you are able to see that patient's information, where she has entered in her problem list, her past surgeries, her allergies, etc. You do notice here that her meds list is not shown, so you will go and update her medications list, and a smoking assessment has not been addressed. Also to the right, you will notice the patient's progress note has been scanned in from her primary care physician, and you can see any scanned-in notes that have been pulled into the patient's chart prior to her visit. You do need to get her meds list, and you also need to get a tobacco use assessment to meet meaningful use. So to do that, the nurse is going to go in, pull a template in, and begin documenting. On the history, you see the patient is allergic to penicillin, but she also tells you that she forgot to enter in that she is allergic to sulfa as well. You make that quick update to the patient's allergy list. Select the sulfa from our list of choices and then indicate she breaks out in hives. Her social history. You'll indicate that she is a smoker. She currently smokes every day and she smokes less than a pack of cigarettes per day. Now you have updated her smoking assessment and you have also done her allergy list. You indicate that the patient has taken some over-the-counter medications for aches and pains that she experiences at times, so you'll pull in ibuprofen. If the patient also has been prescribed medications by other providers, those medications will reside in her fill history. So any provider that has prescribed this patient any medication that she had filled by her insurance, it will reside here, and you can pull that right into today's record. Once that has been reconciled, you can indicate that by selecting the Reconciled button, and it indicates the medications list has been reconciled, which is now meeting meaningful use. So you have updated her problem list, her allergies, her medications list, and her social history, including her tobacco use, which is meeting all the meaningful use requirements. Next, you will import her vitals. You need to get her vitals because she has not been here previously. You can just pull in her current weight and her height, as well as her blood pressure. Once that information has been pulled in, it automatically calculates her body mass index, which is a meaningful use requirement. This is based on her height and weight, which is an automatic calculation in Allscripts Professional EHR. Next, you will jump right to the review of systems for the patient and document a normal breast exam and also pull in abnormal findings typically found for a patient coming in with a breast lump. So as you can see here, anything in red indicates an abnormal examination. If there is anything else you want to indicate or make any other changes, you can do that by selecting the item you want and then indicating another change there. So you make a change to the review of systems that the patient forgot to enter her nipple pain, and now it is documented in the visit. Here is what the note looks like before you send it off to the provider. She is a 40-year-old female, and then there is her review of systems. As you are looking at this note, you realize you did not put in the reason for her visit. It is very easy to go in, jump back to the chief complaint, and document the patient is here for breast problems. She is having breast pain and tenderness, and as you select these items from your HPI, It documents it in the note here at the bottom. She also indicated a little bit of breast swelling. This has been going on for the past month, and there is no fever associated with it or weight loss or fatigue. Now that is added to the note. When you take a look at the note now, you notice that the chief complaint HPI had been added. So now you are ready to send the chart to the provider, Dr. Sell. You will tell her exactly which room you're putting the patient in and let her know the patient is tired of waiting. And then you send the chart over. Now you're logged in as Dr. Sell. Dr. Sell is logged in here and she can see her schedule. On the right, she can see her queues and her inbox. These show all the work that she needs to take care of today. The received charts show where all the patients have been roomed and their status. This patient is in exam room 6 for a breast lump. The nurse put a sticky note on the chart telling you that the patient is tired of waiting. When you select that, you can actually see the note that has already been created by the patient and the nurse. Next, the provider is going back into the complaint and will ask the patient more questions about their breast pain. If there are any risk factors, yes, she has early menstruation, she does smoke, and then when was her last menstrual period? She says it was last month. All that information pulls right into the patient's record. Now the doctor will jump right to the physical examination and do a complete breast exam. That drops into the record any typical physical findings for a patient coming in with breast pain. These will display here as a positive finding. If there is something you need to change, you simply select the area that you want to change and then document that it is pretty tender and there may be a little bit of dimpling as well. If there is anything else you want to pull in here, you can certainly do that. If you want to see a full visit of this breast exam, you can expand your template and look at the full note. So for example, you want to indicate where the breast lump is, on the left tail, and is about 5 millimeters, and again, it is pretty tender. The consistency is firm, it is mobile, and the shape is oval. So if there is anything else you want to document here, you can certainly do that by clicking in the template entry, and then it pulls it right into the note. You can also indicate where you found the lump. Now that is going to be attached to the patient's record. You can certainly take a picture of that patient as well and also import that right into the note. Now that you have that as part of the record, you can move to the treatment plan and view what your recommendations are for this patient. In the assessment and plan, you will notice you have protocols based on the patient's visit. In this example here, you have the protocol for breast lump with the ICD-9 code and the suggested treatment plan already in place. So in this case, you want to get a mammogram for this patient and possibly do a fine needle aspiration, and then give the patient an education sheet. Simply select it, and it drops into the patient's current plan for today. Once that's been generated, the provider can schedule that out about a week or so in advance and then have the front desks change it if that does not meet the patient's needs. The final note shows again, filled in by the patient through the portal, the nurse, and now the provider. Once the provider is finished with this documentation, you can use the E&M calculator to generate the score of the visit based on the note that has been documented. So you will indicate that this is a new problem with additional workup planned, and this is a consult visit for a new patient. It will calculate the visit and suggest the level of service is at 99202. The summary sheet tells you exactly what you may have missed in order to achieve a higher level of service. So here you will see the history was only expanded. You documented 3 HPI elements, when you need to get at least 4 in order to get to the next level of service. It's the same with your exam. You only documented 9 bullet points and you need to get 12 to get a detailed exam. You do have the ability to override that or go back in and further document, provided you put in a reason why you overwrote the code. Clicking Sign Off on the visit will generate a super bill. The super bill indicates that you are going to bill the patient at 99202. Order the mammogram for the patient and also send a referral letter back to the referring doctor. There's the consult letter back to the referring doctor, and you can also generate a clinical summary for the patient at the end of the visit, which is meeting a meaningful use requirement. When you sign off on that visit, those 2 notes will generate. Here is an example of a consult letter back to the referring doctor. It comes directly from the visit and pulls that information into the letter, the treatment plan, and then the doctor's signature. If you want to make a change here, you can simply go in and edit your findings and indicate that the patient is not a very pleasant individual. If you know the doctor's first name, you can also enter that the provider knows the doctor personally. You can actually very easily go on and enter that in. The clinical summary allows you to meet a meaningful use requirement by generating a summary of the visit. At the end of the visit, you can hand it to the patient. Once you have signed off, the note files itself away. Over in your queues and your inbox, you have the ability to look at any messages and phone calls that come over to you throughout the day that you may not have seen earlier. As you notice here, any messages that are available for you to take action on are listed here with a number. Anything in red indicates that it is an urgent message. If you need to talk to a patient right away and you want to see what the patient is calling regarding, it actually shows the message that came over from your nurse. If you wanted to, you could see their last appointment and even go into their face sheet to see their last visit. By selecting that, you could see her last visit when she had the mammogram done, and you can also see everything else that was done during that visit. If you want to review the note itself, you select that note and then it will appear for you to view as you are responding to the message. You can now send a message back to the nurse to say, "Please call the patient back," and let her know it would be early morning. Then the message is removed from your inbox. You can also run reports on patients that have had certain surgeries that need to have a follow-up exam that have not come back in. So Allscripts Professional EHR allows you to do those types of reports very easily. You can also run reports based on meaningful use criteria. For example, to check on all of your providers that are not meeting meaningful use for e-prescribing. You can run those reports and take a quick look and see which providers in your practice are meeting meaningful use for e-prescribing and which are not. For example, Dr. Entler is at 50%. Allscripts Professional EHR not only addresses your daily challenges, but connects to 180,000 physician users, 1,500 hospitals, third-party devices and applications, labs and pharmacies across the country. Allscripts Practice Management Solution seamlessly. The Allscripts Referral Network. To patients through the patient portal. To patient charts remotely with our Allscripts Remote for Apple iPhone, iPod Touch, BlackBerry, or any Windows mobile device. It is your entire healthcare community connected. To request a custom ROI assessment or a personal product demonstration, please call Allscripts at 1-877-EHR-NOW1 or email ehrnow@allscripts.com or visit www.allscripts.com/professional.